Hello, good morning. I am Dr. Kaiser. I'm the Chief Hepatologist here at Aster Hospital, Mankhool in Dubai, and I am the part of the Aster Integrated Liver Care team. Today I'm going to tell you about liver health in general and something about fatty liver disease, which is the most common form of liver disease lots of people are suffering from in this part of the world. Now, when it comes to liver health, usually as a layman, we are not very sure whether our livers are healthy or not. It's not like diabetes, cholesterol, or high blood pressure, where there is a simple blood test or an investigation which will tell you that you are suffering from a problem, and then you can take corrective measures and medications to sort out the problem. Liver health is more complicated. The reason being that the liver does not trouble you, it does not hurt you, it does not make you feel any problem. It is said that the liver might be damaged 60 to 70% without the patient having any symptom of liver disease. Well, that makes liver disease quite scary. You might be suffering from a serious liver problem like liver cirrhosis or advanced fatty liver disease or a viral infection of the liver like hepatitis B and C, and yet you may not be aware that you're having a liver problem. The reason is that the liver is a big organ. It is the largest organ of the body and it's got extreme reserve. So that is why even if 2/3 of the liver is damaged, you still have enough functional capacity of the liver to make you feel healthy and your system's working. So how, in the end, does a patient still know he has got liver disease or not? Well, you still need some tests. Well, the basic tests are, for example, a blood test called a liver function test. The liver function test tells you about the levels of various enzymes, bilirubin levels in the blood, and tells you a general idea about liver health. But remember, your liver function test can be absolutely normal and still you might be having an affection of the liver. The second test is an ultrasound scan of the liver. The ultrasound scan tells you about the size of the liver, the structure of the liver, and most importantly, if there is fat content inside the liver. This is important because, as I mentioned previously, fatty liver is an important cause of liver disease. In fact, it is the most common cause of liver disease in the world. I would say 50% of patients with liver disease have fatty liver disease. So let me tell you a brief about what exactly this fatty liver disease is. Fatty liver disease is simple to understand. It's excess fat in the liver. The problem is that what does this excess fat do? In many cases, I would say 80-90% cases, the excess fat will not produce any problem. But in a small minority of patients, 10 to 20%, especially those who are overweight, who don't do exercise, who take heavy fatty food and heavy carbohydrate food, who have diabetes, and who are typically above the age of 40 to 45, in these patients, the fatty liver disease is of a serious type, and it's called steatohepatitis. That means along with fat, there is inflammation in the liver. And this inflammation in the liver slowly damages the liver, causes scarring, and causes a condition called liver cirrhosis. Now, liver cirrhosis happens over a period of 15-20 years. And in these 15-20 years, patients feel healthy and asymptomatic and don't approach a doctor. When you do reach a doctor, you might have advanced liver disease. And at that time, things might be too late. So it's important to recognize that one has fatty liver, and especially the bad form of fatty liver, which is called steatohepatitis, and then take corrective actions. How do you treat this fatty liver? Apart from lifestyle modifications, modification of diet, having a healthy lifestyle, maintaining good body weight, doing regular exercise, control of diabetes, high blood pressure and cholesterol is extremely important. And now there are some new drugs which are available, which specifically are used for patients who have got the advanced form of fatty liver disease. Apart from fatty liver disease, one must also realize there are many other diseases, especially hepatitis B and C. These are viruses in the liver. And again, one will not be aware that a person is suffering from these viruses if it does not get tested. It is a good idea to get tested at least once in your lifetime for hepatitis B and C. Not to forget alcohol. Alcohol still remains the major cause of liver disease, and people should understand that they should drink alcohol in limits. And people who drink excess alcohol should get their livers checked. So I hope that I've been able to convey to you that liver health is an important aspect of overall health, and it needs to be checked just like you check for other diseases like diabetes, high blood pressure and cholesterol. I'm available here at Aster Hospital, and we'll be happy to see you in case you're interested in consulting us for your liver health. Thank you very much.